Good morning, world. I am Judy, your web-based therapist, making therapy accessible and convenient for our clients in Florida and New York, and of course, sharing information worldwide. Today, I wanted to come on and talk about 5 mental health issues that can be triggered or impacted during a pandemic. Because as you know, right now, pretty much the whole world is in a state of panic with with everything that's going on with this virus. And during these times when everyone around us seem to be in such panic and there's so much chaos going on, a lot of mental health issues can be impacted, and that's why today we're talking about 5 of them. First of which, of course, is anxiety. Right now, people who suffer from anxiety and people who don't suffer from anxiety are experiencing a great deal of anxiety. So if you normally have anxiety related issues, if you normally suffer from anxiety disorders, the simple fact that so many other people there's so much chaos and so many other people are experiencing that anxiety, they will, or they can, or are likely to contribute to your experiencing even more than you normally experience. And the intensity of the anxiety you experience may be even stronger. The symptoms may be even more frequent than you normally have, by the simple fact that there are so many more sources, so many more things to influence or encourage or impact the anxiety that you would normally be experiencing. So be mindful of that so that you're taking time to do all the things, implement all the resources, use all the tools that you have at your disposal that you normally engage in order to manage your own anxiety. So make sure that you're using them a little bit extra now. Depression is the second one, because a lot of things have been thrown into chaos. That's my best way of, actually, I really call it pandemonium, but right now everything is going haywire. And a lot of the resources that people normally use to help them manage depressive symptoms are now less available. For instance, a lot of schools are closing, a lot of workplaces are closing, and a lot of jobs are having people work from home. So normally when I work with people suffering from depression, one of the things that we always work on is getting them to do things to get to engage with the outside world, getting them to participate getting them to engage in life outside of what's going on inside their house. But right now they're saying, yeah, you need to stay in your house. So since a lot of these resources are not available, it becomes, it almost creates a nice little bubble where depression can bloom or foster or grow or manifest, or whatever it is that you would call it. So just be mindful of that. So if you normally experience symptoms, those symptoms can be present. Those symptoms are more likely to present, and you have fewer resources to deal with them. So just make sure that you are using any resources that are still available to you. Any resources that you can, new resources that you can put in place, any new resources that you can get access to, make sure that you're paying attention to your symptoms, paying attention to what you're feeling, and using whatever resources are available to help you manage them. 3. Hypochondria is a little bit, I guess it's been changed in the DSM right now. It's split over illness, anxiety disorder, somatic symptom disorder, and high health anxiety. But what people normally know is the hypochondria. So I'll just talk about that. And that is that constant I don't want to say obsession, but preoccupation with being ill, hearing symptoms and suddenly feeling that, hey, maybe I have that. With this current COVID-19 that's happening, we know so little about. A lot of times, and of course the symptoms being so much like symptoms of other things. So it is very possible to become obsessed with it, to become preoccupied with it. Just make sure that, hey, you're keeping in mind that this is a possibility. So when things are coming up, you're doing, again, everything you normally do, everything you usually do to manage the symptoms, that you're doing them so that you're managing these symptoms. ADHD is another one. when I work with people with ADHD, we normally talk about ways to put systems in place, things to do, having organization systems, having plans, having, ADHD is managed through systems. And right now, a lot of these systems are being impacted, are being disrupted. With that, what you're going to need to do is be on constant alert to manage or adjust your systems, adjust your plans, adjust your organization system, adjust your schedule so that you're still doing as much of the normal management stuff that you normally do to manage your ADHD, to keep as much of a streamline as you possibly can in the midst of this chaos, because it is happening right now. But at some point when everything comes down, you still have to go back to your regular normal life, and you don't want to allow so much disarray to take place, so that when things get back to normal for the rest of the world, you're starting over again. So just make sure that you're paying attention to what is happening. And OCD, of course, is another one. With obsessive compulsive disorder, it's a lot of it is about gaining a little bit of control, of something, getting a handle on something. And right now, within this moment where we feel so much less in control, where there's so much that we cannot control because a lot of it is out of our hand, it can trigger these symptoms. So be mindful of that and pay attention to your behaviors, pay attention to your triggers, and again, employ every resource that you normally use that you have available. If resources that you normally use are not available, just make sure that you're finding new resources, finding ways, paying attention to your symptoms, and finding ways to deal with and manage and get them under control. Is really any stress, any illness that is triggered by stress is at risk, right? If you have any illness that is triggered by stress, you are at risk right now, because a lot of people are experiencing it, and the more people around you are experiencing stress, the more likely they are to influence you or cause you to experience a little bit more stress. Okay, so quick recap. 1, anxiety. 2, depression. 3, hypochondria or illness, anxiety disorder, somatic symptom disorder, high health anxiety, all those. And of course, ADHD and obsessive compulsive disorder. If you if you know someone who deals with these things, make sure you're reaching out and checking on them, because right now is probably a tougher or a more difficult time for them. So they could definitely use that support. And of course, if you are the one who suffers from them, make sure you're paying a lot closer attention to your symptoms, to to your behaviors, because things are more likely to be triggered right now. And yes, any disorders that are normally stress triggered are likely to be triggered right now. So just be mindful and pay attention. And as usual, if you or someone you know happens to be dealing with something that's more than you can handle, there's a lot of help out there. There are a lot of people able and willing to help you. And even right now, when we're talking about social distancing, there are a lot of people who provide services virtually. So please reach out and get the help that you need. And that is all we have for today. Good morning, world. Have an awesome day.